Okay, guys, someone tell me, what do you mean by this skill? In the simplest way, in your own words. It's not the exam. So someone tell me, what do you mean by this skill? Anyone?
Skill where it's the kind act of some showing some communication and also the professionalism. That's the most important thing.
Okay. Professionalism and the communication. So basically, I'm asking about the overall. What do you mean by this skill? Okay. In my
You are
word,
asking about
not for the MRCS. Okay. As a whole, what do you mean by this skill? Okay. I'm helping you, Dr. Manar. Okay. In my own words, skill means or skills are such kind of things. Those things are or those things won't develop in a single day, and you'll have to do those things by doing repeatedly, and eventually those things will be converted into a reflex, and ultimately when those things will convert into a reflex, and that is called the skills and developing the skill. So from this definition, you already got that if you want to pass the skill portion, that what your main motto or what your main objective. If you want to, yes, practice, doing practice every single day. Okay. If I just evaluate our recent candidates who has passed in the exam or who hasn't passed, and I have noticed none of our candidates fail in the knowledge portion. No one, except in the last Kuala Lumpur, one of our very close candidate failed in the knowledge portion, but that is different thing because something isn't in your hand. But one thing, few candidates failed from our course, and I'm really worried from them because we'll let you know how to practice. We'll let you know. We'll show you the strategies how to overcome this skill portions, but we can't directly observe you. If you don't practice, it's not in our hand, because you'll have to always practice in your own way with your reading partner, and you'll have to discuss with us. So after finishing the last course, whenever we arranged a simulation course, we found few candidates, and most of the candidates from the other courses, they joined with us. And I was so frustrated to see their performance, and eventually I wanted to ask them not to sit for the exam, but there was no enough time wasn't in our hand. That's why I didn't want to demotivate them. That's why I didn't say anything. Just I looked for the and focus the thing they will have to increase their ability. That's why I asked them to focus on particular part, and by doing those things before the exam. And unfortunately, I have seen most of the candidates failed. Those are not in our course. They're from different courses, and we didn't have enough time to increase their ability within 3 days. So unfortunately, they failed in the skill part. So skill is very difficult part. But if you do practice in a very regular basis, if you do practice under a supervision, if you always talk with us, discuss with us, where we'll have to emphasize, and ultimately will pass in the skill part. So it's very important. You'll have to do practice, and all of you know that few candidates have joined with us recently, and they are very, I would say, definitely I would say they are lucky enough that they are going to start their preparation of the skill part. So I would request you while you are preparing for the skill part, along preparing the skill part, please go through the previous classes knowledge portion, because all the classes has already been recorded. Just look for the old folders and look for the recorded classes and do practice with the knowledge part. And ultimately, after finishing the skill part, we'll come back to knowledge part in a cyclical way, and you will able to join us later on, no problem. But whenever we'll again practice with the knowledge part, you will have the ability, you will have the access to practice skill along with the knowledge part. Just think, those candidates who has joined with the knowledge part, they didn't practice the skill at all. They was only busy with the knowledge part. But who are joining with us with the skill part, they are getting the access, or they are getting the opportunity to practice the knowledge as well, because all the classes have been uploaded. Okay, that's great. So before starting the class, I have already said we have divided today's class into 5 segments. At first, we'll discuss about the history taking, about the skills, and ultimately history taking, how the history taking is, you'll have to perform the history taking, what are the main segments and the preparatory stations from the history taking. Then we'll practice different 4 history taking. And if you just, I would say, if you just know how to start the history taking, and if you if you can convert this pro forma into your reflex, you won't have to fight with the history taking. That will be very, very, very easier for you. Okay, that's great, guys. Okay, so guys, let's start with the skills. So our today's class start with the skills. So at first, tell me, how many stations do you have in the skill part? How many stations do you have?
9.
9 stations.
9.
9
Nine
stations.
station.
Okay, very good. So these 9 stations are converted. History taking. Okay. Examination station. Then procedures, and the communications. Okay. So you will get how many history taking stations in your exam? 2 stations. And you have 25 stations in your book. Okay. So if you practice 25 stations, you will get 2 stations common in your exam. Okay. And you will get 3 exam stations. And how many stations do you have in your book? 22 stations. So you'll have to prepare, or you will have to know the procedures or examination skills, 22 stations, and you'll get common 3 stations in your real exam. Then come for the procedures. How many procedure stations you will have? 2 stations. 2 stations. And you will have to practice 6 stations. 6 stations overseas examining. Who are going to sit for the exam outside the UK, you will have to practice 6 stations. But who are going to appear in the exam, we'll have to practice 1 more station, that is called what? Test drain. We haven't seen to give the chest drain in the overseas stations, because for the chest drain, they will have to carry a large mannequins with the chest and head. That's why it is not very commonly given in the exam. Okay, now come to the communication. So communication stations are divided into 2. One is person communication, and another one is phone call. Okay, so you will have 1 person communication common, 1 stations. And how many stations you'll have to practice? 8 stations, or hardly 9 stations. And you will have 1 phone call, 1 stations. Yes, 1 station out of 7 stations. Okay, so these are your skill part. Here, the most easiest parts are the history taking. Sorry, I'm just going to give another color, history taking, and the procedural stations. These are the most easiest part. Believe me, guys, if you can prepare very well and prepare the history taking stations, and all of you know that for every single station you'll have 20 marks. So if you can prepare yourself, you will get, or you are bound to get, at least 17 for every single station. 17 marks for each station. So 17 into 17 is 34. And I think 35 to getting 35 is very, very, very simple. Very simple to get 35. So in history taking station, we'll come to know a common format. We'll learn a common format, and we'll have to focus this format, and you'll have to practice all the history taking stations except two. Those are like important, and the MMSC. These two history taking stations are different. We'll come to know this thing later on, no problem. But rest of the history taking are almost same. That's why if you practice for the rest of 3 months or 4 months, I don't know how many time do you have in your hand, or 6 months, 8 months, it will be really, really handy. It won't be a big deal. Just focus the time and try to complete your history taking within the time. It's a very friendly station. We'll come to this later on. Okay. So you'll get 3 exam stations, and definitely we'll have the revision class, the exam station later on, no problem. Along with the procedure stations, 2 stations we'll get common 2 stations. Definitely we'll have the preparatory station, preparatory class on the procedure and communication as well. But remember, the communication station, or if you ask me which portion is the most difficult part for the skill part, that is the communication. It's very, very difficult. Very difficult. But who has appeared in the exam? Like I don't know, is there anyone in our right now in our class who has appeared in the exam or not? But if you ask someone, which which station was easier for you among the all procedure stations, and definitely I know they will say communication station, especially the person communication station. They will say this was the easiest part. But after getting the mark, they'll come to know the person or the candidate got the lowest mark in the communication part. It's a very, very difficult part. Just think, in the communication station, in the person communication station, you will have 3 person in the room, 2 examiners. One is your professor or from the medical background, and another one is layman examiner, and another one is the patient. So whenever you enter into the room, the examiner will ask you, okay, have you read the stem? Are you prepared? Now counsel the patient. Then you will start talking with the patient, nothing else. So whenever you will start talking with the patient, and definitely the way you have learned, you will counsel the patient, and ultimately your conversation will be done within 9 minutes, and ultimately will come out from the room. So what does that mean? You didn't have any difficulties in the visiting station, in the person communication, because you are just talking with the patient. The patient won't charge you, the patient won't ask any question from the medical background, so those things won't be difficult for you. So as you are not getting any question, as you are not stuck in any part of the station, that's why you are thinking it was the most easiest part, because you didn't do any mistake. But there are 2 person who are observing you very closely and very strictly. They are marking you. Ultimately, if you don't follow the portfolio, or if you don't follow the rules, ultimately they will give you a very, very small amount of mark, and it's very difficult to get the mark, especially the overseas candidates, especially the Asians and overseas candidates. It's very difficult. That's why I am telling you from the very beginning of the skill part, that person communication, even the phone communication, These two stations are the most difficult part. Okay, so start with the history taking. So we have already mentioned we'll get two history taking stations in our exam. Okay, before that, I would like to show you the scenario, how the stations are arranged. Okay, so like this is the classroom. We always try to give you a proper environment to have some knowledge regarding the, especially regarding the exam hall. So this is the classroom. There will be a table here, and this is a chair. This is a chair. Here will be a chair. I am just telling you the real scenario of the or exam hall. And here is another chair, another chair. Okay, this is the door. This is the door, and there will be a board hanging over here. There's a board, and this red person is you. Okay, so when the bell will ring, you will get 1 minute, 1 minute to read the question here. 1 minute. Okay, whenever 1 minute is done, you will enter into the room. So whenever you will enter into the room, your examiner, especially this person, will say, okay, Mr. Okay, like whenever you will enter into the room, definitely you will greet your consultant at looking all of the three persons. Sir, good evening, sir. I am Dr. Rifat, one of the salary candidates, or my candidate number is 123. Then this person is a professor, a consultant, will say, are you ready? Are you ready with your station? Yes, I am ready. Okay, this is your patient. Be seated and start your station. So you will come here. Ultimately, you will come here. You will sit down here, and you will have to start. Okay. So every single station, you will have 10 minutes. 10 minutes. Already 1 minute is covered here. So whenever you will sit down here, you will have 6 minutes to talk with this patient, with this person. So how many minutes do you have? Do you left? How many? How many minutes do you have already?
It's
You have 7 minutes already done. There 1 minute, there 6 minutes, and you will have after 6 minutes the bell will ring, and you will have to turn towards the consultant as well as the layman examiner toward them. You'll have to look toward them, and they will have 3 minutes, 3 more minutes, 3 minutes to ask you the present the case and ask you the cross questions or the follow-up questions. So this is the 10 minutes. So 1 minute to read the stem, 6 minutes to take the history, and 3 minutes to talk with the consultant and as well as the layman. So though layman examiner won't ask you any question, she or he will be silent throughout the examination. She is a silent killer basically. Mostly they are female, most of the cases, those are silent killer. And this is the consultant, and he or she will ask you the questions, follow-up questions. Are you getting me, guys? So someone tell me about the time distribution. You will have 10 minutes. So how the times are distributed?
So first 1 minute for the STEM,
Mm-hmm.
then 6 minutes for the proper history taking,
Mm-hmm.
and 3 minutes for the cross question that actually by the surgical examiner.
Okay. So cross questions are always fixed, guys. Cross questions are always fixed. Remember, there are three cross questions, almost, or the follow-up questions. Follow-up questions. Questions. Number one, would you like to present your case? Present your case or tell the positive findings. Findings. Number one question. Okay. How would you like to investigate? How would you like to investigate the patient? So what is your management? What is your management? main. These three questions are same for every single history taking station. These three questions are same. But if you can do very well, then they can ask you few more questions from their own reference. They may ask you from some enthusiasm. They may ask you. So these three questions are same. So whenever you are preparing for any history taking station, so you'll have to learn at least three follow-up questions. One is, would you like to present your case or tell the positive finding? How do you like to investigate the patient or go for the confirmed diagnosis? And what are the management options? Okay. Now come for the mark distribution. Okay. Total mark for the every single station, mark distribution. Marks. Okay. So how many marks do you have for every single station?
20 marks.
Okay, 20 marks. 20 marks. Okay. In some books, in some references, they are saying 15 marks, 15 marks on the consultant, and 5 marks will be given by the layman examiner, layman examiner. So 15 marks depends on the consultant and only 5 marks on the layman examiner. On the other hand, you can divide these things 12, 4, 4. Okay. This 12 is for the history taking itself. This 4 for the follow-up questions and medical knowledge, and 4 marks by the layman examiner. So these things varies basically. These things always varies. So here will be just your professionalism, your way of communication, every single thing. But I think you don't have to remember the mark distribution. You'll have to know the procedure, or you'll have to know the proper way how to take the history taking. Nothing else. You don't look for the mark distribution, because every single mark is very important for the exam. I have seen so many candidates to fail for only 1 mark. I don't know why this is happening for the MRC especially. They're failing only 1 mark. It's a very common scenario for the MRCS OSCE exam. So don't look for the mark distribution. Only look for the 20 marks you'll have, and you'll have to get at least 17 out of 20. Okay, I'll let you know how to get. Now, your important thing, what is the role of the layman examiner? Okay, always remember, the patient is always actor. The patient is always actor. It's very important. He is not a real patient. The role of the layman examiner is he or she is a silent killer. They won't talk to you, not even a single word is not needed. They won't talk to you at all. So what is the role of them? They basically will observe you, will see your body language, how you are acting. Like if the patient is saying anything like, okay, doctor, I am having severe headache. On that time, you are smiling. Rather, you are supposed to have some empathy for the patient, but rather you are smiling. That's the body language. Like patient is talking with you and you are looking toward the ceiling. So it's very, very important. Like when the patient is telling something, you are looking on the other side. But when the patient is telling something, you then act like I'm getting you, just head nodding by head nodding. So you'll have to head nodding. Have to do the head nodding for the eye contact. Eye contact. Always remember, eye contact is very important. Very, very, very important. Not only for this station, as well as the person communication. Eye contact. Like for the rapport build up, rapport with the patient. Just you'll have to merge with the patient. Just feel the pain of the patient. Otherwise, you won't get the mark for the professionalism. So you'll have to build some rapport. Like the patient is telling he is having severe pain, you'll have to show some empathy. Then show some empathy. Empathy, very important. Like like whether you are using any medical term or not, like you'll have to always use the language, means patient's language. Like you are not allowed to use any medical term with the patient. You'll have to say like tummy instead of abdomen, uh, and all of these things eventually will be discussed. Like not allowed to say any medical jargon or terms. These are the thing the patient will observe. This is the part of the layman examiner. Am I clear to Bhaiya? Guys, am I clear to? Please let me know if you are getting me.
Yes,
Just let me
Yes,
know.
Bhaiya.
Yes, Bhaiya.
Okay, so I'm just giving you an overview. Eventually, whenever we'll start into practicing, you'll come to know how these things are. You'll have to apply. Okay, now come for the steps. You will get so many steps, like in your book you will get so many steps, but I am just telling you the simplest way you'll have to practice for all the stations except two. So if you can write it down, just you can start writing. Okay, steps of history taking station. Number one. Okay, you are the red person. So whenever you enter into the room, like whenever you enter into the room, you'll have to greet, hello sir, good evening, I am Dr. Rifat. Like, hello sir, good evening. If you are doing the exam in the morning, then say good morning, I am Dr. Rifat, one of the candidates for today. Start like this, sir. Okay, so they will say, did you read the stem, or are you ready with your station? Yes sir. Yes sir, I'm ready. Then they will show you, this is your patient, please be seated and start your station. Okay, then you'll have to sit down and you'll have to say good evening or whatever you want. Okay, so hello, good evening, I'm Dr. Rifat, one of the surgical candidates. May I confirm your name and age? So you'll have to say at first, whenever you enter into the room, you will talk with the consultant. Hello, sir. Good evening. I'm Dr. Rifat, one of the surgical candidates for today. Okay, they will say you. Are you ready? Be seated. Start. Then come to the patient. Patient with the patient. Hello. Just greet the patient again. Hello, I'm Dr. Rifat, one of the surgical candidates for today. Then may I confirm your name and age? Just talk with the patient. And someone tell me, yes, I am Dr. Smith, or I am Smith. I am 25 years old. Okay, then say, so this is number one with the consultant, this is number two with the patient. Then say, they will answer you. Then say, nice to meet you. Nice to meet you, Mr. like Alex. Nice to meet you, Mr. Alex. So you at first you greet with the patient, introduce yourself. I am Dr. Rifat. Then introduce yourself, greet the patient, good evening. Then confirm the patient name and age. Okay. Then go for your final task. You will have to, your station is to take the history from the patient. So you'll have to get the verbal consent. So number 4, get verbal consent. So how will you get the verbal consent? So just in your own words, today I have been asked to, today I have been asked to ask you few questions regarding the problem you are suffering from. Okay. Are you okay with that? Okay. So today I've been asked to ask you a few questions regarding the problem you are suffering from. Okay. Are you okay with that? So the patient will definitely say, yes, please continue. No problem. I am okay with that. Are you getting me, guys? Are you getting me?
Yes, भैया.
Yes, bhaiya.
Okay. So come to the station again. So while you are taking the history, this is the consultant, this is the layman examiner, this is the patient. So at first you are talking with the consultant, then turn around the patient. Now you will have to just turn like this way. So if you want, you can talk with the consultant as well, and you are definitely talking with the patient. Don't keep your chair like this way, and don't turn like this way and talk with the patient. Just move your body just 45-degree angle, and you will have the access to talk with the consultant as well as with the patient. It's very important. Are you getting me, guys? Just think, you are looking towards this and you are talking with the patient, so it will be very difficult. So body language is very important. So you'll have to keep your position 45-degree like this, sir, and you will have the access to talk with the patient perfectly. While you won't able to turn 90-degree, there's one reason, because this is the table, right? Dr. Ankit, are you getting me? This is the table. So over the table, okay, that's good. So over the table, you will get one paper and pen here. So definitely, as this paper and pen has been kept here for one reason. What is the role of the paper and pen? To write something, right? So these things are given by the RCS, the exam hall. So definitely you'll have to use this thing. I have seen so many patients, so many doctors or candidates, they didn't use this thing. But I think as you are going to take a long history and you will have to take so many things, very important notes. So it's very, very important to take the notes while you are talking with the patient. That's why if you turn 45-degree, then you'll have the access to talk with the consultant, your patient, as well as you'll able to write down something on the table. And just if you turn 90-degree with the patient, and it will be very difficult to write something over the table. Are you getting me, guys? Please let me know.
Yes, भैया.
So, yes, it's very
Yes,
important.
bhaiya.
So always turn your body at 45-degree. Okay. Now you will talk with the patient as well as you will have to write something. So just think about this. Like, you are talking with the patient and you ask the patient something, and patient has answered you something, and you are writing for a long period of time. It's a very, very unprofessional. So what we'll have to do? Definitely, you will have to seek for the permission. that you are going to take some notes while you are talking with the patient. So before starting the conversation, before starting to the final conversation, take the permission that you are going to take some notes while you are talking with the patient. So just like this, sir. Okay, thank you. Okay, while I am talking, I am taking the history. I would like to take some notes. I would like to take some notes in the paper. Are you good with that? Just take the verbal consent as well of taking the notes of the patient. So just tell the patient, okay, Mr. Smith or Alex, while while I am taking the history, I would like to note it down, or I would like to take some notes, or note it down, or take some notes on the paper. Are you okay with that? So definitely they will say, yes, doctor, no problem, no problem. They will definitely they will say you, yes, doctor, no problem. Okay. So what are you going to note it down? Remember, you will have only 6 minutes in your hand. You are only 6 minutes in your hand, and you are not allowed to take the whole history, note the whole history, and it's not practical. While you're taking the history, as there is no mark for taking writing down over the part, so it's a part of the history taking. So while you're taking the notes, you don't have to note it down every single thing. So what will you note it down? Just take the paper, and you'll ask the patient about okay, patient already said his name and age. Just write the name, just like Mr. Alex 45. Alex 45. After that, they will say you, okay, doctor, I am having severe tummy pain. Just write down tummy pain, and definitely he will ask you for how long. They will say you 4 months, just for M. I can remember, still I can remember, while I was just writing in the paper, this examiner was standing up and was looking for what I am writing over the paper. So it's a part of the examination. Definitely it's a part of examination. That's why they kept the paper and pen over the table. So it's very important. So you just, if you are not habituated to take the notes, and if you just get the difficulties to take the notes while you are talking with the patient, just write the name, age, at least the occupation, and the main problem. These 4 or 5 words at least. And definitely you can write this thing at looking with the patient. While you are talking with the patient, you can write this thing in the paper. It's normal. It's a very easier thing, I think. Okay, we'll come to this thing later on, no problem. So you have taken the permission to write it down. Okay. Now you will have to ask the few questions. Okay. You'll have to remember few questions, basic principle of the history taking. You will get 4 types of questions. One is open question, one is closed question, one is focus question, and another one is fixed question. Okay. For starting the history station, you'll have to ask the open question. Open question. So you'll have to start the station by asking the open question. So what would be the open question? So how can I help you today? How can I help you today? So what seems to be the problem today? What seems to be the problem today? In your own words, what seems the problem today? Or how can I help you today? Okay. So definitely they will say you that, okay, doctor, I'm having severe headache. I'm having headache today. And definitely, while they are talking their problem, you'll have to show some empathy. So you'll have to show some empathy. So answer by the patient, pain, or problem. So when they will show tell you a pain or some problem, show some empathy. 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 So how would you like to show the empathy? Do you have any idea? Okay, I'm
So
extremely
sorry,
sorry to. Yes.
I'm so
Okay,
sorry to hear
sorry
that.
to hear
I
that.
am so sorry to hear that. In a simplest way. In a simplest way. I'm so sorry to hear that, or I'm so sorry to know that, Mr. Alex. Okay. So if they ask you, like they are telling you they're having some pain, and definitely by keeping the patient in the pain is very, very illogical to take the history. Settle down the pain, then go for the history taking. So always remember, if the patient is complaining any pain as their chief complaint, just offer the painkiller. Offer painkiller as well. As well. Are you getting me, Bhaiya? Everyone? Are you getting me? Mm-hmm. Mm-hmm. Please let me know.
Yes,
Are you
yeah.
Yes,
Yes, Bhaiya.
okay? Offer the painkiller. Okay, like patient is complaining like uh, um, meningitis or headache or something. So whenever you are just turn off the lights or dim the light, the patient condition will be improved. So if the patient is having headache, or your diagnosis is meningitis, so how will you come to know this is meningitis? We'll come discuss this later on, no problem. Meningitis, uh, offer to switch off of the light. Okay, Dr. Manat, I'm just talking to you. Okay, Dr. Okay, Mr. Manat, could you tell me what seems the problem today? Dr. Manat, could you tell me?
yes, doctor. I am actually feel some pain into my upper.
Okay, I am extremely sorry to know that. So do you need any painkiller right now?
No, doctor. I'll get this
Okay,
30.
okay, that's great. Okay, can we proceed? Can you proceed?
Yes, yes, sure.
Yes. Okay, this is the way. But if the patient is complaining, yes, you can give some painkiller. Okay, start again. Okay, Mr. Manat, could you tell me what seems to the problem today?
Yes, doctor. I'm actually feel some tummy pain into my upper tummy.
Okay, I'm extremely sorry to know that. So, do you need any painkiller?
Yes, doctor. It will be very good if I'll get this right now.
Okay, so just you are at this position, just turn your head toward the consultant and talk with the consultant. Sir, patient needs some painkiller as the patient is having pain right now. Are you getting me? The purpose of sitting like this way. Are you getting me,
Yes,
guys?
Bhaiya.
Okay, just
Yes, Bhaiya.
turn toward the patient and say toward the consultant and say the consultant, sir, patient is having some pain and patient needs some painkiller. Then your consultant definitely won't give you any painkiller. He will say, no problem. Suppose painkiller has been provided, proceed on. Then turn to the patient again and start your history taking station. Okay. So whenever they will say you a painkiller, you will have to break the painkiller. Okay. So how will you describe the or break the pain? Break pain history. You'll have to break the pain history by using Soc
Socrates.
Right.
Socrates. Okay. So S stands for sight. S stands for site. O stands for onset. Onset. C stands
Site.
for characteristics. Characteristics. Okay. R stands for radiation.
Radiation.
Radiation. A stands for association.
Associative
Association.
factor.
Yes. T stands for timing. Timing.
Time.
Okay. It stands for exacerbating. Exacerbating or relieving. Relieving factors. Factors. And stands for severity.
Severity.
Severity or pain score. Score of pain. Score of pain. These are the 10, 1, 2, 3, 4, 5, 6, 7, 8. Okay. These are the 8 questions you'll have to ask. Those are related with the pain. So breaking the pain is very, very, very important. So you'll have to ask the all of the 8 things with the pain. Am I clear to you, Bhaiya? Everyone, please let me know. So let's
Yes,
start.
Bhaiya. Yes, Bhaiya.
Okay, let's start. Dr. Manarath, could you tell me when did you why do you feel the pain, Dr. Manarath?
Yes, doctor, I feel the pain in my upper tummy.
Okay. So when did it start?
Mm, I think it start actually initially it's gradually. If initially it's suddenly, then I feel it's gradually increased.
Okay. Could you tell me in your own words uh, about the nature of the pain? Is it crampy, crushing, or colic in nature?
I think it's like colicky.
Okay. I'm writing it down. Okay. Could you tell me, does the pain go anywhere?
Yes, doctor, I actually noticed that my pain is settled down into my back.
Okay. So, Mr. Marat, could you tell me, is there anything is associated with your pain, like you're having the vomiting or anything, a fever?
No, doctor.
Okay. So, is there any specific time of the day that the pain increases?
Actually, I don't notice this.
Okay. That's great. So, is there anything that increases your pain or anything that relieve your pain?
Yes, I think when I'll take some fatty food, that's actually increase my pain. And when I'm actually uh, bending forward, that actually gives some relief.
Okay, I'm writing it down. Okay, Mr. Manarat. So, if I ask you to score the pain, like 1 is the least pain and 10, being 10 is the highest worst pain. So how would you mark this pain?
I think it's 7 or 8.
Okay, I'm so really sorry to know that you are having a huge amount of pain. I'm sorry to know that, or you are in a huge pain. So these are the 8 questions. Like this way, you'll have to ask. Always remember, just just in your own words, don't fight with the language. I am telling you, it is not the exam of the language, rather it is exam of the medical background, exam of the communication, all of this thing. I have seen so many persons with huge difficulties or deficiencies with the English background. They are very perfectly passing in the exam. So don't fight with the by asking the questions. Just ask your own words. Don't bother with the grammatical abnormalities, nothing else. No problem, guys. Okay, these are the 8 things. 8 things. Those are associated with the pain. Okay, now they will ask you sometimes. There are several things. Those are you will get in the history taking station other than the pain. Okay, like patient complaining, not pain, there is no pain, like patients complaining, rectal bleeding, bleeding. rectal bleeding, or others. Always remember, for the others thing, you can use another mnemonics, OD
Udipara.
para. Okay. For the other problem, O stands for onset, D is for duration, I stands for intensity, P stands for progression. Which one is left? A, right? A stands for aggravating factor. R stands for definitely
Relieving
relieving factor, and A stands for associated or associated factors or features. Okay, these are the 1, 2, 3, 4, 5, 6, 7. These are the 7 things. Okay, now I'm talking with Dr. Shabnam. Okay, Dr. Shabnam. So, what seems to be the problem today? Just tell me. Any problem? Any problem? Dr. Afia Shabnam, are you here? Okay, Dr. Shamim Asha, Apu, are you here? No one likes to talk to me, right? Guys, can you hear me?
Yes, bro.
Okay, only you can hear me. Okay, so, okay,
Yes, bro.
no problem. So, Dr. Marat, okay, Mr. Marat, so what seems to be the problem today?
Okay, doctor. So I'm recently noticed there is some blood actually passing through my stool.
Okay, I am sorry to know that. So, uh, when did it start? When did it start?
Okay, so it start actually for last 3 days. I'm noticing.
Okay, okay. How did it start? Is it start silently or gradually?
It's actually not suddenly. I think it's gradual actually.
Okay, okay. Tell me how badly it affects your day-to-day life activity.
Yes, I'm actually. It's actually affect my day-to-day life. I feel some difficulties.
Okay, so is it progressively worsening day by day? What do you think?
Yes, I think it's worse day by day.
Okay, I'm sorry to know that. So, is there anything that is increasing your condition bad?
I didn't notice that.
Okay, Mr. Manoj, did you notice that anything that is relieving or improving your condition?
I think there's nothing significant.
Okay, okay, Mr. Marat, have you noticed anything that is associated with your problem, like any tummy pain or something else, any vomiting?
Yes, yes, I have actually big tummy pain, and when
I'm sorry to know
actually
that.
passing,
Okay, I'm sorry to
yes,
know that. Okay, so these are the things you can describe by using the Odipara. These are the things. But I would suggest, if you don't want to describe like this way, just in your own words, like simply in your own words. Okay, when did you first start? Did you start suddenly or gradually? Okay, just ignore these two questions. When did you first start? Start suddenly or gradually? Is there anything that increases your condition improved? Or is there anything that makes your condition? Is there anything that relieves your difficulties? Is there anything that increases your difficulties? Or have you noticed anything that is associated with your problem? These are the thing you can ask in your own words. Please, guys, use the uh, use the mic rather than writing in the. Okay, you are with the kids. Okay, Apu, no problem, no problem. Okay, so these are the things you will have to describe by using the modifier. Okay, now come to the. So you have described the problem. You have described the problem and you have described the pain. Now you have to go for the differential diagnosis. Differential diagnosis. Okay. Always remember, you you might get 6, 7, 8 differentials in your book. But I'm telling you right now, don't dare to practice by using 7, 8. Maximum you are allowed to practice with 6. And I am assuring you, 4 differentials, exclusion of 4 differentials is enough. Exclusion of 4 differentials in the exam, it is enough. And if you do have enough time in your hands, you are allowed to exclude 5 differentials maximum. 5 differentials maximum. Don't dare to go for, I'm telling you again, don't dare to go for more than 5 differentials. Never. If you go for more than 5 differentials, I am telling you right now, you will be in a deep sea. You won't able to cover the rest of the portion, rest of the history in time. Never. Just like you got character bleeding station in your exam. So whenever you're getting the character station, you'll think it's a very simple, it's a very tiny, very easiest thing. I know at least 8 or 9 differentials. So it's a very simple thing. So definitely I can go for the all differentials. So you are thinking you will get a more than in a high amount of mark if you can go for the 7, 8 differences. No, you are allowed to go for 5 differences maximum, but always I will try to cover within 4 differences, most important. And every single differentials has a specific question. Just go for the specific questions. Simply ask for the specific questions. And you are allowed to ask 2 to 3 questions for each differentials. 3 questions maximum 3 questions for each differentials. You will get 4, 5. 4 is also okay, no problem. If you want, you can go for the 4 questions. That is also okay. But don't go for the more than 4 questions. But 3 questions is enough for every single differentials. Are you getting me, Bhaiya? Everyone? Are you getting me?
Yes, sir.
Yes, bhaiya.
Okay. 4 differentials. Okay. Now, when you are done with the differentials, then you'll have to go for the post-medical and surgical history. So we are in number what? Which number we are right now? 7. Empathy done. Okay, these are the 8 specific questions. We have the 9 specific questions. Then 10 is the differentials. 10. Now we'll have to go for the 11. We'll have to go for the post-medical, past medical and surgical question. Past medical and surgical question. So how can you ask this question? Okay, do you have any other medical condition like asthma, COPD, tuberculosis? You can mention these things because these are the medical conditions previously, and these are the chronic illness. So definitely the patient knows their diagnosis. So you can use this terminology at the past medical history. So, or you can simply ask in own words. So, Mr. Manat, do you have any past medical illness, or have you undergone any surgeries before? Is there any surgical history? In your own words,
Yes,
you'll have to.
yes.
Mhm.
I'm actually seeking my GP, like I have diagnosed bronchial asthma.
Okay,
And also
I'm
I
writing it down.
undergone the cholecystectomy.
Okay. So you have done with the past medical history or past medical history and the surgical history. Then go for the medication, medications and allergy history, allergic history. Okay. So do you take any medication regularly? Do you take any medication regularly?
Yes, doctor. Actually, I'm
Okay,
also
could you
hypertensive.
could you tell me the name of the drug?
Yes, I'll take lansoprazole. Sorry. I'll take
Okay, no problem.
something like calcium channel.
Okay, that's good. Thank you very much. Okay, so go for the medication history. Okay, could you tell me, is there known allergy? Uh, is there anything allergic to you, or is there any known allergy?
No.
Okay, do you have any allergies to any medications or foods or any substance like this? So in your own words, guys, I'm telling you several times, telling you it's not the exam of language, rather the exam of medical background, for the medical background assessment of the um, medical background. So you are allowed to talk with the patient in your own words in simplest way, no problem. So you can ask for the allergic history. Do you have any allergies to any medications or foods, anything? You can ask like this, sir. So we have done with the past medical illness, past surgical history, medication history, allergic history. And if you want, you can also add the immunization history. But I think it is not needed. It is not needed. Don't go for this one. It will consume your time. Okay. So these are the thing you'll have to look for. Then you'll have to go for another very important thing that is called the personal history. Personal history. Okay. So this is number 13. Okay. Under personal history, start with the occupation. Occupational history. Okay, so what do you ask? How do you ask? What do you do for your living? In a simplest way, what do you do for living? They will say about their occupation. Okay, always remember, in the personal history, you are not allowed to judge. Judgment is not allowed. Because are you clear, Bhaiya, everyone? Judgment is not allowed here. Never. Okay, just in your own words, before starting the personal history, you'll have to seek for the permission. Seek for permission. Permission that you are going to go for the personal history. Okay, like this. Okay, Mr. Manad, would you like if I ask you a few personal question? Would you mind if I ask you a few more personal questions? So what do you answer, Mr. Manad? He will definitely say, oh, no problem, doctor, please carry on. Yes. So what do you do for living? And they might tell you so many things. They might tell you so many things. No problem. So never ever judge. Don't use your judgment here. Never dare to go for judgment. They might ask you, I'll tell you like their occupation, they are working as a sex worker. No, you are not allowed to smile, or you are not allowed to humiliate the patient. So these are very personal things. You have already seek for the permission, and you are asking the question personal history. Never judge the patient. So this is the occupation. Then you can go for the marital history. So for the marital history, you can ask, because in the Western countries they are living together even without marriage. So don't ask like this, sir. Just simply you can ask who lives with you at your home. In a simplest way. So go for the marital history. How would you ask the question? Somebody tell me who
Whom do you live
lives
with you
with
at home?
you at your home. Just simply You can ask this question. So what do you do for living? Who lives with you at your home? In a simplest way. Okay. Then go for the family history. Family history for the same illness. Like this is a case of parental bleeding. So you can simply ask in your own words. So, Mr. Manat, is there anyone in your family is suffering from the same kind of illness? In a simplest way. So, is there anyone of your family member suffering from same kind of illness? Like this way. In its simplest way. Is there anyone who is suffering from same kind of your family member is suffering from the same kind of illness? You just simply ask this thing. Okay. Then go for the number 16, go for the smoking history. Smoking. And number 7 is the alcohol. Alcohol. Okay. So do you smoke? Do you take alcohol or do you smoke? Okay. Do you drink alcohol? And if they ask, yes, I do smoke, then go for the how many sticks for how long. Or if they tell you, yes, I drink sometimes. Okay, tell me how many packs for how long. Never, you are not allowed to judge here. Don't go for okay, no, why, Mr. Marat, why are you smoking? Smoking is very dangerous for the health. Just quit smoking. No, you're not allowed to say this thing. You are not allowed to say like alcohol is very dangerous. It causes liver cirrhosis, liver cancer. No, you are not allowed to judge the patient. Am I clear to you, Bhaiya? Everyone, please let me know.
Yes, ma'am.
Yes, ma'am.
Okay,
Yes, yes.
okay. So we have done with the alcohol history, smoking history, and the family history. And if you want to keep the family history later on after the alcohol, that is also okay, no problem. After that, you can take the family history. Okay, then our work is to go for number 18. Okay, number 18 basically is for systemic illness. Systemic illness. Systemic illness. Okay, how do you like to start? Always start from the head to toe. Okay, like number 1. Okay, so you'll have to start this question, and this question is a fixed question, fixed type of questions. I have already mentioned you will get 4 questions for the history taking. One is open question, one is closed, focus, and fixed question, and this is the fixed question. Like you are only seeking for yes or no. So how you would like to ask the question? Okay, Mr. Manat, I am going to ask you a few more questions. Just tell me by saying yes or no, like this way. Just tell me, just answer me by saying yes or no. Okay. Do you have from the head to toe headache, headache, eye ache, blurring of vision? Then go for the mouth ulcer. Then go for the cough, breathlessness, chest pain. Then go for the tummy pain. Yes, tummy pain. Alteration of bowel habits. Alteration bowel habits. Any muscle pain or joint pain. About the urinary abnormalities. About the urinary abnormalities, you can ask your questions. Problem with your loo, then any muscle pain or joint pain. So you will have to ask this question answer this question by saying yes or no. So just have a look here. This was a question of parectal bleeding. So you have already discussed all about the tummy pain, alteration, bowel habits. So don't ask this question in the systemic reviews. Even in the parectal bleeding, you will also go for the IVD, right? IVD. So you will get the extraintestinal manifestation like the mouth ulcer, in the musculoskeletal joint pain. You have already asked this question in the as a part of the IVD. So these questions are not needed to ask again. Only the rest of the questions, those has not been asked, you will allow to ask this question again. Am I clear to you? Everyone, please let me know. It's very important.
Yes.
We are just building the main concept, the history taking, and I can beg you and I can say you, if you are ready with the portfolio or this format, it will be really easier for you. Someone was talking to me, was asking any question. Please talk to me. Someone. Is there any question left for you? Guys, please let me know.
No, bhai.
Okay. System review has been done. Now come for the number. What is our number? That is 19. Okay. After systemic reviews, we'll have very important thing, that is the
Nice.
ICE. I is for idea. You'll have to ask the patient, do you have any idea what are you suffering from? Okay. The patient might tell you, okay, doctor, my sister or one of my relatives had such kind of illness, and he has diagnosed as a colon cancer, and I think I am also suffering from colon cancer. Okay, don't go for the conclusion. Don't say, as you are thinking also it's a colon cancer, don't go for the conclusion or the final diagnosis. Just go for a diplomatic answer. Okay, Mr. Marat, I think it's very early to say. You just came to me, and we just taking the history. After that, we'll take some, do some examination, investigation, and finally we'll come to a final diagnosis. I think it's very early to say something like this way. So, in the part of all of these three things, you'll have the console the patient. Console the patient. So, at first, ask the question, do you have any idea what are you suffering from? Then go for the concern. So patient complaining so many problems, like patient will have, like in parectal bleeding, patient will have the ultrasound bowel habit. The patient will have parectal bleeding. The patient might get have few weight loss. So you'll have to ask, what are you most concerned about? Because patient complains about so many problems. That's why you'll have to ask, sorry, what are you most concerned about? So they will pick a problem for all of these things. Like they will say, doctor, I think I'm dying. I'm having bleeding with a stool, with my bowel opening. Would you please stop this bleeding? And definitely you'll have to console the patient by any means. Just say, yes, definitely, Mr. Marat, we are here to support you. No worries, nothing to worry about. Definitely you're in the right hand right now. We are here to support you. Guys, are you getting me? It's all about the skill, basically. It's all about this skill. So you'll have to console the patient. Okay, now number E is for the expectations. Expectations. Just say what do you expect us to do for you? Because patient is having so many problems. Patient might have main concern, and patient may have a most important expectations. Just cure me. Like this, please cure me my expectation. That's your here, and definitely show some empathy or the console the patient. Am I clear to you, everyone? Am I clear to you? Please let me know. So this
Yes,
is
ma'am.
the ICE. So after that, whenever ICE is done, then go for the conclusion by saying, okay, Mr. Okay, Mr. Manarat, thank you for your for your kind cooperation. Okay, I will. So to reach a final diagnosis, so what are the steps? At first, history taking, then clinical examinations, then investigations, then to reach a final diagnosis, consult with consultant. And after discussing with the consultant, you will have a final diagnosis. These are the steps. So you are just at the beginning of your pathway. So you are only taking the history. So thank you very much, Mr. Mara. Thank you for your kind cooperation. I will do some clinical examination, investigation, and talk with my consultant. Talk with my consultant regarding your problem. Your problem. Okay, and we'll come back to you. We'll come back to you. And the last question, is there anything that I have missed to ask you, but you'd like to mention? The number 21, you have done almost. Okay, is there anything that I have missed to ask you, but you would like to mention? And they will definitely say you, no, doctor, you have covered every single thing. Thank you very much. And no, there is nothing left. Then go for the, okay, thank you. I'll come back to you, or I'll get back to you. Okay, thank you. Thank you. I will get back to you soon. I'll get back to you soon. Then you can mention, like, if there are any further queries, don't hesitate to contact with me. I'll give my bleep number with the nurse station. Have a nice day. Thank you. Blah 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 in your own words. These are the 22 steps for the history taking. And if you can practice like this, and this thing will be really easier for you, and definitely history taking won't be a big deal for you. This is all about the history taking. So let's practice with someone. So is there anyone who would like to practice?
Yes, ma'am.
Is there anyone? Yes. Okay.
Yes, ma'am.
So, okay, Dr. Arifin. Dr. Arifin, are you here? You are the first who said the yes, bhaiya. Okay, that's great. Let's start. Let's start from step one. I'm your patient, and definitely nothing to be worried about the finding. I'll just answering the questions. Let's start, and I'll get with a feedback what are the thing you have missed, or where to improve, or what about your performance. Let's start. You are the patient. You entered into the hall. Start from here. You are the patient. You found one meat and enter into the room. Okay. Before that, I would like to say, okay, guys, remember, in the history taking station, always remember, I am telling you, and whenever I will take the history taking station, I will warn you a very important thing. Always remember, don't try to be a over smart candidate. Never. I'm telling you, MRCS Part B exam is very simple. If you why the consultants or the big surgeons or very famous surgeons are failing in the MRCS exam, rather very junior doctors are passing in the exam. What's the reason behind this? Because the consultants are know so many things. They think I know so many things and I won't follow the RCS rule. But RCS won't give you the pass mark until you follow their rules. Remember, that's why they are failing. Just always remember, follow their rules. If you blindly follow their rules, don't go for the excess thing that are not mentioning in the class. And blindly, if you follow us, definitely will pass in the exam. Inshallah, no problem. Just follow the rules. And why I am telling you, if you get parectal bleeding in your exam, definitely the diagnosis will be the carcinoma of the colon. Never dare to convert your diagnosis into the rectal polyp, anal fissure, or something else. Never. It's a prefix question, fixed question. If you are getting in your exam, patient is having the morphine, like there are 3 lines, question is given in your door, and there is written it down, the patient is having a morphine, your diagnosis is chronic pancreatitis. Never dare to turn into a acute pancreatitis, never. Are you getting me, Bhaiya? If you are getting a patient is having breathlessness, is a cholecystectomy patient, or you are planning to go for the cholecystectomy and patient is having breathlessness, don't dare to turn this patient other cause of breathlessness like MI or heart failure or the pulmonary embolism. Rather, is a case of anxiety. Are you getting me? Don't dare to convert your diagnosis. Always stick with the book. Am I clear to you, Bhaiya? Arifin, am I clear?
Yes, Bhaiya.
Okay, let's start. So this is you, and while you are reading the question, and definitely you will able to, there are 1 line or 2 line or 3 lines questions, and to read the 3 lines questions, you will have 1 minute to read the 3 lines. So definitely you will be done within 20 seconds, and definitely you will come to know which station has been given inside. So the rest of the 40 seconds rest. So 20 seconds for diagnosis after reading the question, and rest 40 seconds for differentials. Just as you are standing here, you spend 20 seconds to read the question and you have reached into your diagnosis. Then use rest of the 40 seconds for the differentials. Just think what are the differentials you would like to keep in this station, and what are the questions those are related with your differentials. Are you getting me, Bhaiya? Dr. Arifin, are you
Yes.
getting me, Bhaiya? Okay. So
Yes, Bhaiya.
these are the differentials. You'll have to think questions for the differentials for the rest of the 40 seconds. And while you are memorizing those things by standing outside the door, and it will be really easier to deliver inside the room. Just believe me. And I
Okay.
have seen in my exam, in 1 station, I found almost 18. And I used this strategy in my real exam. So always try to fix or focus like this way. Okay, guys. Okay, so start. I'm helping you, no problem. Just to practice the format. Okay, Dr. Arifin, let's start.
Okay, so I have read the STEM. Now I'm going to the examiner. Hello, sir. Good afternoon. I am Dr. Arifin. My candidate number is 27.
Okay, have you read the question?
Yes, sir.
Are you prepared with your station?
Yes, sir.
Okay, be seated and start your station. This is your patient.
Okay. Thank you. Okay. Hello, sir. Good afternoon. I am Dr. Arifin, one of the surgical candidates. May I confirm your name and age, please?
Yes, I'm Rifat, 31-year-old.
Okay, it's nice to meet you, Mr. Rifat. So today I've been told to ask you some questions regarding your conditions that may help us to aid your diagnosis. Is that okay with you?
Yes, doctor, definitely, no problem. Please carry on.
Okay, thank you so much. So, can you tell me what brings you here today?
Doctor, I am having a severe problem with my urine. I think I am suffering a lot.
Okay. So, um, okay. So, so which way should I continue here?
Okay,
I just
okay. So up to this portion, you have done your introduction. That is okay, no problem. You have asked me, no problem. You have take the verbal consent, but you haven't take about the consent of the written.
Oh yes,
Like you
yes.
are writing some notes, so you didn't take for this. Okay. For any question you have asked about the open question, that is absolutely correct, no problem. For any problem, here my problem was not the pain. If I was
Yeah.
complaining about the pain, you had to go for the 8 questions, those are related with the pain. But if you are getting other conditions other than the pain, you'll have to break the Odipara, this one. Or
Yes,
in the
yes.
simplest
Yeah.
way, like when did you first notice the problem? Did it started suddenly or gradually? Okay, is there anything
Yes.
that improves your condition? Is there anything that deteriorates your condition? Okay, is there anything that is associated with this thing? Like this way, you'll have to ask these fixed questions.
Okay.
Then you'll have to go for the differential. Those are questions like what are the my diagnosis was like benign or enlarged prostate, benign prostate hyperplasia, something as this is not used right now clinically. We use from the urology. This is the enlarged prostate. So you'll have to go for the differentials. So what are the differentials with the enlarged prostate? Like LOTS, like infection, like any stone, whatever. There are so many differentials. We'll discuss those things in particular class. So you'll have to break all the questions. Okay, suppose you have asked all the questions up to this portion, differential has been done, then come for the past medical history. Now start again.
Yeah. Okay. So, do you have any kinds of medical illness for which you have to go to the GP?
Yes, doctor, I am having diabetes for the last 6 months.
Oh, so do you take medications?
Yes, I take metformin.
Oh, okay. So, do you notice any kinds of allergy to any known medication or foods or dust?
No, doctor, there is no allergy.
Oh, yeah. So, have you undergone any recent surgeries before?
Yes, doctor, I had cholecystectomy 10 years back.
Okay. So, have you completed your immunization in childhood?
Okay, yes, I have completed every single thing previously.
Okay. So, now I am going to ask you a few questions about your personal life. Is that okay?
Yes, doctor, definitely, please carry on, no problem.
Yeah. So, could you tell me what do you do for living?
I'm a school teacher.
Okay. So, could you tell me whom do you live with?
Yes, with my mom.
Okay. So, can you remember if is there any of your family members that suffering from same kinds of illness?
As far I can remember, my dad has same kind of illness, doctor.
Oh, I'm very sorry to hear that. So, do you take cigarettes?
Yes, I'm a chain smoker.
Oh, okay. Do you drink alcohol?
Sometimes, doctor, not in
Okay.
a
So,
regular basis. Yes, yes.
okay. So, do you have any headache or any eye ache or blurring of vision?
Okay, before starting the systemic illness, so what did I mention? How to start? Is the which kind of question this one? This is the fixed question. So I would like to
Yeah.
mention the I will say the patient. Like whenever you will ask the patient, do you have any headache? The patient may say you, yes, doctor, I had headache 10 years back, and that was really, really bad, and I couldn't stand up from the sitting down. I had to lie down all the day long. And they may say so many things, and you don't have enough time. That's why you have turned into a fixed question by answering yes or no only. The patient is not
Okay.
allowed to say any more thing other than by saying yes or no. So just say, okay, Mr. Alex, okay, Mr. Rifat, I'm going to ask you a few more questions. Just answer by saying yes or no. So start again.
Very good. Okay. Okay. So, okay. So, Mr. Rifat, now I would like to ask you some questions, and you have to answer it by saying yes or no. Okay.
Yes, no problem. Please
Okay.
continue.
So, okay. So, do you have any headache or eye or blurring of vision?
No problem. No, doctor.
Okay. Do you have any mouth ulcer?
No,
Okay. Are you suffering from any kinds of coughing, breathlessness, or chest pain?
no, doctor.
Okay. So, um, so can you okay. So, do you have any tummy pain? How is your bowel or bladder habit?
Yes, doctor, I think I'm having the constipation.
Oh, okay. I'm sorry to hear that. Do you have any kinds of muscle pain or joint pain?
Mm-hmm. No problem.
So any problem with your loo?
No problem, doctor. Yes, you have already
Oh,
discussed about the loo. We are
yeah.
discussing with the loo. I have so many problems
Yeah.
with the loo.
Yes. Okay. Yeah, I'm very sorry to hear that. So, could you please tell me what is your idea about your condition?
Doctor, basically, I already mentioned my dad has same type of illness, and ultimately my dad diagnosed as a carcinoma of the prostate, and I don't know really what is happening to me. I think I
Yeah.
do
Well,
have the cancer as well. I'm really
uh,
frustrated.
yeah. Actually, it's quite early to reveal this news. Actually, I have to uh, do some further investigations and consult with my consultant. Then we can actually reveal the news. Okay. So, what concerns you the most?
Okay, Dr. Arifin, reveal and the say two things are different. Like in the reveal, you are already almost confirmed, so you don't like to say the diagnosis to the patient. So by saying that, you are still confused. You don't know. So I think you should prefer to use the word say, right? So go for
Say.
the
Okay.
by say
Yes.
yes. Okay. So
Say.
looking for the
So, what
appropriate word
concern
is
you?
also important. Okay,
Yes.
doctor,
Definitely.
I am mostly concerned about my frequency because I had to wake up from the sleeping several times at night.
Yeah, I can understand. So, what do you want us to do for you?
Definitely, please save me so that I don't have to die just like my dad.
Yeah, definitely. We will try our best. So, okay, Mr. Rifat. Thank you for your kind cooperation. I will do some clinical examinations, investigations, and then I will talk to my consultant regarding your condition, and we will come back to you later. So, is there
Yes,
anything that I might have missed to ask you that I should have asked or you would like to mention?
no problem. I think, doctor, you have mentioned every single thing perfectly.
Okay. Thank you so much. I will get back to you soon. So, in the meantime, if you ever feel that any kinds of information you need to mention, then don't hesitate to contact with me. I will leave my bleep number at the nurse station. Thank you so much. Have a nice day.
Yes, thank you very much, doctor. Thank you. Okay. So we have down the station. So after station, you will be asked three more questions. These are the follow-up questions. Follow-up questions. So what are the three questions? Number one, would you like to present
Provisional. Okay.
or positive findings? Number two, I would like to investigate the patient. Number three, I would like to treat the patient. These are the three fixed questions. And for asking these three questions, 3 minutes is needed, and the consultant has 3 minutes in his hand. So if you can answer all the 3 questions within 2 minutes, you'll have 1 more minutes. So the consultant might ask you few more questions from his own reference to give you much more mark in the exam center. But nothing to be worried about if you can't answer those questions, because there's no mark for those questions in the answer script. But if you can answer those questions as well, they will have a good impression for you. Okay, so how would you like to present the case, or go for the positive finding? But I used to use the positive finding. And if you want, you can go for the presentation. And we have given a format for the presentation, how you have to present this thing, will come to know. Okay, just remember, while you are taking the history, you will have to take some notes, right? In your paper, you have to take some notes. But while you are taking some notes, you don't have enough time to writing it down and the talking with the patient as well or simultaneously. I'd suggest you just mention the only words those you are going to use as a positive finding. Only the words. Okay, just think about a patient with the colon cancer. Like we had a patient right few minutes back. Okay, patient is Mr. Alex. Mention about the Alex, 60 years. Alex, 60 years. And patient is having weight loss. Like mention about the 10 kilos over 10 months, like this way. Loss of appetite, altered bowel habit. Your examiners are not going to look for what are you writing down here. They might look for, is there anything you are writing here or not? But is there any spelling mistake? Is there any important thing has been written here or not? These are not important. So just use the most important thing while you are writing. Like in the carcinoma of the colon, the patient will have a positive finding of the family history, like patient mother, positive history of mother CA colon, like this way. Just write the positive finding. So while you are answering the positive finding, just have a look over here. Just say, yes, the patient is 60 years old male, and patient has a history of alteration of the bowel habits for the last 6 months, patient and the loss of appetite, and patient has parectal bleeding. Start with the parectal bleeding, alteration of bowel habits, loss of appetite. Patient had a family history of the colon cancer and all other positive findings. Then considering the situation, they will ask you what are the differentiations, so you can go for the differential diagnosis. Am I clear to where? Everyone, am I clear to you? So
Yes, ma'am.
only
Yes.
write this thing. Another tricks I would like to mention here, it's worth repeating again. While you are writing these positive findings, just mention loudly, because the patient is saying, okay, Dr. Arifin, I'm talking with you. Okay, Mr. Arifin, could you tell me, is there any history of anyone is suffering from such kind of illness from your family? Or is there anyone is suffering from the same kind of illness in your family?
Yes,
You,
doctor.
you, you,
Yes.
Mhm.
Yeah, actually, my grandfather suffered from the same kinds of illness, and he died due to the suffering.
The patient will say, my grandfather or mother died from the colon cancer in this particular station, or mother or father died from the colon cancer. Okay, I am sorry to know that. I'm writing it down. Just tell the patient, I am writing it down. Just within 5 seconds, just write positive mother colon cancer. So while you are taking the positive findings, you know this station previously. Before entering this station, you already know this. What are the positive findings you are going to get in this station? You already know that. I already said what are the positive findings you are going to get in this station. These are the positive findings. So while the patient are uttering the positive finding, just loudly say, okay, I am writing down. Just by saying this, look at your paper and write the positive findings in your own words in the simplest form. Then turn towards the patient again and keep going for the further questions. So ultimately, they will ask you for investigations, your treatment, and ultimately your station will be done. So this all about the history taking station. Please, guys, tell me if you do have any questions. It's very, very important, and I can assure you, if you follow all of these instructions, all 19 stations instructions, you are bound to get at least 18 for the exam. I can assure you. But you'll have to keep practicing like this way, and eventually this thing will be very handy for you, and ultimately you will pass the exam, inshallah, no problem. Yes, Dr. Manad, did you want to say anything there?
Yes, Bhaiya. Should the examiners ask
Sorry, I didn't get your question, Bhaiya. I didn't get your question. Please
should
again.
the examiner specifically ask present your case or positive is positive finding,
Yes,
or
yes, the examiner,
they can
it's not a big problem. The examiner will ask always, just present the case. May ask present the case, but simply, if they ask the present the case, just simply go for the, okay, Mr. Alex, 60 years old male, presented with parectal bleeding, loss of appetite, and mention about all the positive findings. And if you want, you can mention 1 or 2 negative findings, as well as any family history, any personal positive findings, any personal family history, and ultimately go for the conclusion. If you practice like this way, it will be okay. But in my case, I can't remember whether I have asked the positive finding. Okay, one situation I have been asked, if would you like to present the case, or you can go for the positive finding. I choose to go for the positive finding. No problem, just go for the positive finding. It won't be a big deal. Just mention about the key points that will establish your diagnosis. That's okay. Nothing else. Yes, Dr. Ankit, please mention your question.
Doctor, good evening. Doctor,
Yes,
my
good evening.
question is that all these 19 points, how are possible to cover in just 6 minutes?
Yes, definitely. And I can assure you, within by 2 or 3 classes, you will be the guy who would able to complete all the things within 6 minutes. No problem. No problem. It won't be a big deal. I had to describe every single thing particularly, separately, and that's why I told you so many things, but it's quite possible to cover within 6 minutes. No problem. Possible. Okay, Dr. Jafrin, did you want to ask anything, Apu?
Yeah, same question. Ankit has
Okay.
like.
Okay, no problem. No problem. You'll able to cover every single thing. No problem, Apu. I can assure you. And everyone did previously from our batch, and definitely you'll be able to cover all the things. So, if you don't have any question, then we can conclude this. We can stop the recording for this introduction.